Welcome to City Line. Well, look at the audience. They're looking good because it's our Looking Good special today. Welcome. We've got a great show for you today. We've got Dr. Steve Mulholland. He's here. You want to talk about cosmetic surgery or anything like that? The advice is free today.
The advice is free.
Now we're gonna say hello to our other guests, but really we're gonna take any question that anybody would have about cosmetic surgery.
Absolutely anything.
But there's a new thing that you're going to show us today. We're really excited about. We'll just get to that in just a moment. Okay. We got Lynn Spence and Derek Selby right over there. Hello.
Good morning.
So, Derek. Are you going to talk about France again?
I'm going to talk about
you
Patrick.
Throw France in my face? The trip I wasn't invited to?
Part 2 of France.
Okay,
yep.
part 2.
And we're going to talk about plant extracts in cosmetics as well.
Okay, very
and
good.
Cellulite.
All right, and then we're going to talk with Lynn about...
Oh, so many ways to keep the sun away from our bodies and to keep cool, to keep comfortable with footwear. All kinds of great products to show you today.
We've got a little fashion in there today on the Looking Good special.
Yeah.
Taking care of yourself today. 416-870-7716, 1-800-295-LINE. You want to give us a call right now. We'll get all the callers ready and get our guests ready to answer those questions. But first, this story. Carol felt she wanted to do something, but it was too early to consider a facelift, so she opted for Thermage. Take a look.
Carol, you're in your early 50s, you're in the health and beauty industry, looking your best matters, and you've done a very good job at that. Now, what bothers you most at this point in your face and your neck?
The part that bothers me the most is my neck, because of all the wrinkles that are created in my neck through age and the droopiness and my gels underneath my eyes. And if I can improve that without surgery at this stage, that would be great.
So if I was to show you in the mirror what a surgical facelift could do, that is definitely what surgery can do, a 100% correction to whatever degree and desire you would like to achieve. That's what surgery will do. The Thermalift is not a replacement for a facelift, it's an alternative. And so when I look at what the Thermalift can do, it's about 30% of that. So if we can get that degree of tightening, that degree of improvement in the jowl, this degree of tightening in the neck, with correction of some of those fine lines, that's great. But there's no downtime, no scars, no recovery. You are repairing the damaged elastics. Imagine that your droopy face and neck is composed of a lot of elastic fibers, like an elastic band. Where you stretch it too far, it starts to turn white and frayed. This electrical current goes into your skin, leaves the skin alone on the surface, but it heats up those damaged elastic fibers and it reforms them, and over 3 or 4 months they tighten and become functional again. They can snap back and pull your neck and your face up. Carol, we're going to be drifting you off to sleep here. What this device is doing is sending radio frequency energy, which is high frequency electrical current, deep into the skin. You can hear the beeping, and the beeping is cooling the superficial layer so you don't get a blister or a burn, but it sends very high current into the skin and it attacks those frayed elastic bands. There's the cooling. Now it's sending heat in. Now it's post-cooling. And for that 2 seconds, it feels like you're being branded at these levels.
Wow, not so hard to look at. Gee, this is an interesting thing. As you said to me during the story, it's very exciting what's happening in cosmetic surgery right now.
It's exciting. I wake up every day and amazed at what we can do now in 2003 that we didn't have in 1997, 98. It's really amazing. There are 2 groups of women. I'm going to pick on women because it's hard to get a man to wash with soap once a day, let alone do anything more advanced.
Can we just kind of isolate that and use that as a promo? Sure we can. Okay, but that, all right, but women,
It's exciting for women because I see 2 groups. I do a lot of facelifts, and there'll always be a facelift group of women who just want to get it done and have recovery. But there's many more women. 90% of all women would love to have a lift effect. Beautiful skin and lift effect without a knife. And that's really what we've arrived at. Nice skin, lifted effect, no knife, no scars, no downtime.
Okay, so no downtime. And you mean no downtime whatsoever?
Well, you need to come in on that day, and as you could see from the tape, there is IV sedation because the device hurts for about 2 seconds. It hurts almost like you're getting branded.
Yeah.
And it hurts. So I give some IV sedation, like a dental anesthesia, a couple of martinis in the IV.
Yeah, couple of dirty martinis. Bye-bye.
It lasts about an hour, but the pain is during the heating, not after. So you wake up, there's no pain.
Okay.
About 5% of people get a little swelling for a day, but 95% are back to work within a day or 2. No blistering, no oozing, no weeping, and you get over about 3 to 12 weeks, you get this lift and tightening effect. And then we add the other things like the photofacials and the Botox and the fillers, and you can easily look 5 to 6 years younger without having a scar on your face.
Okay, so let's go over this again. We're going to go in and get this done because we really don't want to go under the knife, as you say. Okay, so I'm going to go do this, and I probably will. So, why not? So I go in and I can't miss work. So really I would probably take a day off after the fact, but no one's going to see blistering or any of that sort of thing. Okay, fine.
So you would come in.
You'd come in.
Consultation. Risk, benefits, expected outcome.
Yeah.
You would understand the cost, and depending on the practice in Toronto, the cost would be per zone. Some people do their brow and lids, some people do their cheeks, some do the neck, and some do all three.
Okay.
And because each of the hand pieces you see there has a cost, you basically pay for the number of hand pieces that your non-surgical facelift requires.
What, in a ballpark figure, would a whole face neck
Generally,
thing?
it's about $2,000 a zone. So your lids and brow lift is about $2,000. The cheek and jowl is about $2,000. And the neck is about $2,000. To the whole thing is about $6,000.
And if you were to do that under the knife, how much would that cost?
Well, depending on the practice, you could be looking at $25,000, about the price of a fully loaded Dodge minivan.
Minivan facelift. Minivan facelift.
And you only keep one for about 3 years.
This one lasts up to six to 7 years, right? Is that right? Okay.
But kids don't sit on it.
But kids don't sit on it, no. You are so bad. I'm telling you, you see, they have to have a sense of humor. They have to. Okay, so I do that. The procedure is going to cost me this amount of money. Now, let's talk about the maintenance program, because, you know, everything I say in life right now, we want drive-through everything, drive-through satisfaction, but there is a maintenance program. So you mentioned Botox. We know what that's about. We know that, just for the fine lines. Photofacial, let's repeat what a photofacial is again. You're talking about maintenance on that one. That is for...
So you're right. Women want to know exactly what I need to do. And so we give them a roadmap to look your best.
That's right.
And you can pick from this list of options. But in general, after a thermal lift, you will need some work on your deep muscle once a month, about once a season, a photofacial, so at the end of summer, spring, fall,
and a photofacial basically is getting rid of the little red lines and the little imperfections that happen.
It's a complexion treatment.
Okay.
This is a lift treatment, but it doesn't help your complexion.
Right.
Some patients have
That's
sun damage and rosacea and pores.
Those little, right? Those little, veins.
So photofacial has been beautiful for complexion because, again, there's no downtime. You do 3 or 4 treatments and your complexion looks great, but you still may be droopy, saggy, and baggy.
Right.
And this helps with the droopiness, and the photofacial helps with the complexion. And then, depending on your likes and dislikes, you can blend it with a little needle-based therapy like Botox, which relaxes the animation, doesn't paralyze it, modulates it, relaxes it, and maybe a little lip enhancement, because most 50-year-old faces, the lip is kind of like the air out of a balloon.
Or non-existent. It kind of gets underneath.
It hides behind the denture. So, but you really have a menu of options, and what I tend to do is just say, this is a roadmap.
Good.
Where do you want to get, and here's the price to maintain 5 to 6 years younger look.
No fooling around here.
It's really got to be set up for the average busy homemaker or working woman doesn't have time to think about 15 options.
No.
What do I need to do? How do I need to do it? What does it cost? Is it risky? How do I do it?
Okay, and you know what, we're going to see some unbelievable before and afters on this coming up. But the fact is, you got to know the facts. You got to be comfortable with it before you go under any kind of procedure. Is that right?
We're lucky in Toronto. There's many good cosmetic plastic surgeons and cosmetic surgeons that offer these services.
So many, so many. So many people from the States coming up to see you guys too. That's how well known they are. Okay, we're going to take a break. We'll be back right after this.